Well, thank you. We're on the home stretch, and it's my distinct honor now to close this session by introducing Dr. Nadine Kaslow, who is a professor, tenure vice chair for faculty development and equity and inclusion at Emory University. And she is a past president of the American Psychological Association, among many other things that she's done. And she will talk to us this evening about burnout and beating burnout, building a culture of resilience and wellness. I think she was in high demand in the past 3 years during the COVID pandemic. So welcome, Dr. Kaslow.
Well, can you hear me okay? Good afternoon. It's really nice to be here. And in terms of that high demand thing, let me just comment on that. Our chief of neurology called me one day and said, we really need you, we're really struggling. And I said, I feel like that kid at recess who has all the cookies and the candy and has suddenly become popular. And as soon as my cookies and candy go away, I'm not going to have any friends again. And he kind of laughed. And then like 2 hours later, he called me back and he said, no, you're wrong. And I said, about what? This was like a half-hour conversation. He goes, about that cookies and candy. He goes, we finally got it, that we need you. So I think it's kind of sad that we finally got it. And I think it's sad in part because more of us got burned out. So it used to be someone else was burned out. How many of you have been burned out? The rest of you are lying. Okay, so let's talk a little bit about what is this burnout and what can we do about it. And I guess one of the main things, the main takeaway I want to give here is I think we have spent too much time trying to tell you and you and you and you what you should do about it. Because I think the things that are burning us out are not what we can fix necessarily. I think what's burning us out are a lot of the systems issues, the cultural issues, the sort of bigger sort of issues that are burning us out. And if we could just do yoga at noon and be okay, that would be great. But it doesn't work that way. I don't make enough money to have any financial relationships to report. All right, so I do want you to be able to take a little better care of yourselves, and more importantly, maybe, think about in your role, regardless of where you are in your role and what site you're in, what you can do at the organizational or the team level to try to shift this culture to support more resilience and more flourishing. So this is a little bit about what I want to talk about. I'm going to have a series of reflection questions in here. We're going to get a chance to talk more about those in the breakout time. So why are we even having a conversation about this now? Well, I think we all got the sense that we have societal burnout. That's part of this COVID legacy. And even though COVID is, quote, over, COVID changed us forever. I mean, and so there were recent data from the American Psychological Association that showed, not surprisingly, Americans are stressed out. How many of you are stressed out? Yeah. Why? There's a million reasons we're stressed out. COVID and its aftermath, wearing these masks are stressed out, discrimination, racial injustice, money, the economy, climate-related disasters, violence and crime, including mass shootings. I think I saw today the numbers have gone even higher. Healthcare challenges, concerns about our nation, and global challenges. I do want to make a comment about the future of our nation that I don't know if it will be helpful to any of you, but I had the amazing privilege and honor to go to Mrs. Carter's funeral this week. And when I was there and we stood up and sang America the Beautiful, which I've heard 1,000 times or 1,000,000 times, and quite frankly, I'm somebody who's concerned about the future of our nation and has concerned about our nation. And I don't know whether it's because there are all these presidents and first ladies and governors and senators from both sides of the aisle there, but it was one of those moments I stopped and said, there's a lot wrong with our nation, and there's a lot good with our nation. And the fact that we could all be in this space together honoring somebody made me realize the good. And I think that that's part of what's happened to all of us, is we've sort of lost sight of what is good in our healthcare systems, in our nation. So what's the impact of all this stress? There's a lot of trauma. There's more chronic illness, more mental health diagnoses. We've been hearing about more substance use, more social divisiveness for sure. Not everybody's equally impacted. Who's been particularly impacted? Well, we know that parents have. We know that parents really have. Single adult households, there are certain age groups that have been particularly affected. And of course, healthcare workers. The data on healthcare workers are off the charts, with 93% reporting high levels of stress. You see the data on anxiety, on burnout, on depression. These are really high and way different than what things looked like before the pandemic. In addition, we're less happy with our work. We're less satisfied with our work-life balance, or most of us would say, what is balance? At best, we have synthesis, integration. There's some other word, but I don't think balance is it. People are really worried we're going to have a healthcare crisis due to understaffing, burnout. How many of you are underpaid? How many of you feel underappreciated? I won't ask you how many are considering leaving work, in case your boss is here. I think HIV providers experience some additional stress. There's been, at least in certain communities and states, a lot of anti-gay and anti-trans legislation. There's been a lot of legislation that shields providers and insurers who refuse to provide or pay for care due to conflicts with, quote, sincerely held religious, moral, and ethical beliefs, close quote. We know there's been reduced coverage of PrEP and other preventive services, funding cuts for the care that you provide, and other unique stresses. Anybody want to add any particular additional unique stresses? I'm sorry, what? Yeah, that's a stress for all of us. That's not unique to HIV providers, but yes, electronic health records. And so the Surgeon General has sounded the alarm on healthcare worker burnout and resignation, and this is no surprise. So many of you raised your hand and said you were burned out, and what is that? Well, it's something that comes on slowly over time. And it means we're having a hard time managing stress. But again, I want to reiterate, it's not because there's something wrong with me that I'm having a hard time. It's the system. It's the electronic health record. It's all the other inefficiencies. There's a disconnect then that people feel between themselves and the work that they're doing. And again, individuals experience it, but it has to do with systemic and cultural issues. People feel exhausted, they feel disconnected from their work, not a very good sense of kind of pride and personal accomplishment. So I'm not going to take a lot of answers to this, but just one or two. How do you know when you or someone else is burned out? What are the signs? Anybody? Lack of empathy. So it's harder to be empathic, compassionate. What else? I'm sorry, what? It's hard to be available. It's much harder to be available. We don't have the bandwidth to do extra. And so here are some of the most sort of common things that people talk about. And you can see it's physical, it's psychological, it's sort of work-related. Teams are finally getting together and you don't feel like going out. You put on, oh, there's a typo here. You put on all those COVID pounds and you can't take them off. People have died and you don't seem to care the way you used to care. You got some honor or recognition and it's like, oh, well. You keep making small mistakes more than you usually did, and it makes you feel badly about yourself. And this list goes on and on. It's these little things that are the signs, not the big things. So what are the kinds of things that are making you feel burned out? That's making one or two of you feel burned out. Patient load. What else? Insurance challenges, something about staff? Support staff, not enough? Not enough, okay. And I know there's many other things, but it could be, and sometimes it's like the final straw that breaks our back in this. It's a bunch of little things, and then something happens that in the scheme of things is not that big a deal, but it's one more thing we can't handle. So in terms of burnout, there are both risk and protective factors for burnout at the personal level, at the work culture level, our teams, at the health system level, and then these sort of broader societal and cultural levels. And I think we have to be aware of both our risk factors and also our protective factors. So when you think about protective factors that you have against burnout, what protective factors do people have? What's protected you? Yeah. Physical exercise. I'm sorry, what? Family. I'm sorry, what was that one? Sick leave. I'm sorry, what's that one? Therapy. Good. Yeah, therapy. Friends. Meds? Oh, pets. Pets and meds, okay. Pets and meds. Okay. All right, so there's lots of different things, and it's going to be different for each of you. Some of you, pets are really helpful. Some of you, they increase your burnout. Some of you, your family's really helpful. Some of you, they increase your burnout. So being really aware of what works for you. But we know that burnout affects us physically, our ability to cope. Somebody already mentioned their empathy and compassion, mental health and substance use, capacity to take care of other people, and our job satisfaction. Ability to attendance, this is where the sick leave policies issues our effort and productivity. People made the comment about being accessible, being available, teamwork, how satisfied our patients are, and unnecessary costs. And it really affects the community as well. So not just in our health facilities, but in the community as well. Burnout costs a lot of money to the institution, and we have very much seen that over the last few years, the tremendous institutional costs with burnout. So I don't think these are mutually exclusive. I think we can be burned out and resilient, but I do think that part of what we want to do is mitigate this burnout and sort of build our resilience and sense of wellness as much as we can. What does it mean to be resilient? Well, it means to cope well in the face of difficult things. It doesn't mean everything is fine. It means that even with the stress we have, that we can cope well with it, that we can manage it. And what is this wellness thing that people keep talking about? I think it's multiple things. One is having good physical and emotional and social functioning. I really think it also has to do a lot with a more positive approach to living, But I know for me, probably the thing that is the most important, and this is going to be different for each of us, is doing things that I have a sense, give me a sense of meaning and purpose. That, for me, is what matters. And so when I think about what happened during the pandemic, I was really invested in helping people on the front lines. I first felt really guilty that I didn't have the skills to save people's lives. And then I realized that I had the skills to save the lives of the people who had the skills to save people's lives. And that gave me a tremendous sense of meaning. So, what can we do? I'm not going to go through all of these, but I think that this issue of taking care of ourselves is really, really, really important. Many of us get an A+ in taking care of others. We're really good at taking care of others. We do not get such high marks taking care of ourselves. And even if we got a B taking care of ourselves, for most of us, that would be progress. If we don't take care of ourselves, at the end of the day, we're not going to be able to continue to take care of everybody else. There's been all sorts of evidence that self-care interventions really help, and it's helpful to have ones that we can really do in a realistic way. So there's lots of ways to take good care of ourselves physically, and these are ways that I actually think our organizations can help. Having food available for free, having healthy food available. During the pandemic, it was amazing how often pizza was delivered. Then the pandemic went away and food doesn't get delivered anymore. The Starbucks gave free whatever during the pandemic. Now it costs a lot of money. And so really thinking about things, where's the garden outside related to our healthcare systems? Where's the place for us to go to get sun, to get fresh air? How much money has our health system invested in us having comfortable chairs? These are the things that make a difference for people, and yet it isn't really happening. We heard a lot about substance use in the past couple of talks, but it's not just our patients that we need to be concerned about with substance misuse. It's also people in the room who are feeling stressed out and who are misusing substances because they're so stressed out. Finding time, even if it's a little bit of time, to reflect, to sort of write diaries. A lot of people have been doing things like journaling, doing things that are creative, doing things that people enjoy, exercising. Reaching out for support. Many people have gotten better at this over the past few years. Some people have not gotten so much better at this. But reaching out for support, setting limits, saying no when we can't say no. But I also realize we have a culture that makes it hard to do this. So I was telling some people that when I went to get dressed this morning, I discovered I only brought one shoe. So my sneakers that I traveled in did not look great with this outfit. And if we had a really healthy system, I would have shown up here and said, I have one shoe, and so I'm wearing these sneakers. But somehow our systems aren't set up for that. Well, I have size 4 adult shoe. So I go to Nordstrom's, and for $895, they had one pair of size 4 shoes. I decided that was ridiculous. They did in the children's department, however, have a pair of children's size 2 shoes for $18. I decided that was better. But the best thing would have been to just walk in here and not worry about it. However, I've got these adorable children's shoes that I will wear once. So people are looking. They have little bows on them and everything. But they don't light up, so that was really important to me. But I think it tells us something about our culture. All right. Using apps. to help us. And there's all sorts of apps that we use to help us, and here's just a few of them. Practicing mindfulness. How many of you honestly practice mindfulness? That's pretty good, about 6. So I'll tell you a little story. I have a patient of mine who's a physician who gets pretty anxious, and he decided to listen to one of these mindfulness apps before rounds every morning. He did that for 1 week, and his fellow said, "Hey man, what are you, taking a chill pill or something?" And he said, "No, I've been listening to this app before rounds." And so now every day, 15 minutes before rounds, he goes into his office and he opens the door. At 10 minutes before rounds, he closes the door, so there's 5 minutes for people to come in. Turns down the lights, puts on the app. People do this app for 7 minutes, and they go to rounds, and they say it's a really different experience. It's been a shared experience, it's a more mindful experience, and people are a lot more grounded. And there's actually growing evidence supporting mindfulness for healthcare workers. Being compassionate. A lot of us are pretty hard on ourselves. I am sure I'm not the only perfectionist in the group. And just thinking about how kind and compassionate and accepting we can be to others, and trying to find ways to have that same grace for ourselves. Being grateful for things, not the big things in life, but the little things. So I'm going to ask each of you, as I'm talking, to put in your notes or on your piece of paper or whatever, 3 things that you're grateful for today. And it's okay, you can actually be on your phones or your computers while we're doing this. And I want you to think about 3 things that you're grateful for today and write them down. Taking care of your spiritual self. For some of you, this will be your relationship with a higher power. That's not what speaks to everyone. For others of you, thinking about a sense of purpose and meaning in your life, aspiring to be as good as you can be. Finding ways to have balance. Whether or not you use all your sick leave, use all your vacation days. Take every vacation day you have. And just sort of listen to yourself, nurturing those relationships with your pets, your family, your friends outside of work. Building a sense of moral resilience. We have a lot that's really stressful morally to us. And think about what you can do to build your sense of moral resilience. But what can our organizations do? I think we need significant changes in our work cultures. I think leaders, and anyone in here who's a leader at every level, whether that's a team leader or whatever, or a clinic leader or healthcare system leader, we have a responsibility to make significant changes in our work culture. We need to figure out what needs to be changed in our own unique work cultures, because it's different. I know that in some work cultures, I know I work in a system with multiple intersecting work cultures. In some work cultures, it's pretty easy for people to get fired. They make a mistake, it's pretty easy for people to get fired. In other parts of our system, virtually nothing gets somebody fired. Thinking about what's a healthy culture. What policies make sense? There are a lot of policies that we have that make no sense. How do we change them? How do we have a place that feels safe and secure for all of us? Somebody already mentioned I have too many patients on my panel. They're probably not alone. How do we look at people's workloads and have realistic workloads? Ones that are not based on benchmarks that have to do what other health systems do, because that doesn't mean it's any good. That just means we have a culture of people having too many patients on their workload? How do we make sure we have a diverse and inclusive staff and workforce and treat people fairly, where we care about how happy people are in their work? When was the last time you were asked, you enjoying work? What are you satisfied with? What can we do to help you feel better at work? Collaborative decision-making makes all the difference in the world. Most of us are in healthcare systems where the decisions are made by some C-suite who may or may not ever be on the front lines. Bad things do happen where we work. Are people available to us for debriefings to support us during the difficult time? How is it clear to me what my job is, and then what it's not supposed to be? Maybe I shouldn't have to be doing that. How many of us took out the trash during the pandemic? Because if we didn't do it, it wasn't getting taken out. How do we give people some control over their work lives, empower people to do what they do well, really building a much stronger sense of community? I have a new role at work related to all of this, and people kept saying, I want a sense of belonging, and I could just see us doing, survey after survey about belonging. And so I said, well, we're gonna form a choir. It was amazing how many people signed up to be on this choir. And way more than we're ever gonna fill out that survey. How do we have more flexibility at work? People had a certain kind of flexibility with the pandemic that people liked, being able to make decisions about teleworking. How do we build that in? What rewards and incentives can we have available to us? And so we know that there's been a lot that's been stressing us out, that's really been making life much more difficult. Those heavy patient loads, the hours, and patients' mistrust. We were like the heroes and heroines at the beginning of the pandemic, and then nobody wanted to be near us anymore. We need a multi-pronged approach that provides support for individuals, but also comes with organizational change. And I think that if we have such an approach, we'll feel better as individuals, we'll be more compassionate toward ourselves, enjoy work more, and be more resilient. And we'll have less mental health challenges, physical health challenges, substance misuse. This requires our leaders to be committed to this, to care about a culture of wellness and support, of diversity, equity, and inclusivity. There have been a lot of things put in place to reduce workplace inefficiencies. I'm sure some people would argue the health record is that. But I think others would argue it added a different kind of workplace inefficiencies. Focusing on our sense of autonomy and control, we're all adults, and having us treated all as adults, where we can make decisions about things. So I think that moving forward, what I'm really worried about is that everybody said we have to do something about this. We have to do something. At the height of the pandemic, we have to do something. And people put into place some things that actually helped. And now it's like we're going back to the way things used to be, but we are not the same. Many of the lessons we learned, I believe we are now ignoring. And so I really am going to encourage you, each as individuals and as members of your healthcare community, to do what you can to take better care of yourselves and to have the system take better care of you. Thank you, and I'm happy to answer questions.
Thank you so much for this wonderful presentation. I think the calm in the room suggests that it was an effective group therapy. So, any questions?
Questions? Yeah, go.
Thank you for the talk. Coming out of Bridgeport, Connecticut. I wanted to have a comment because this resonates with me. Last week, I had a physician friend of mine, Dr. James O'Halloran, that took his own life. And I wondered to myself, how much did he suffer in silence? He was an HIV provider for 30 years. He worked in various settings, in the jails, FQHCs, had his own private practice. And I just wonder, we want to defend our patients, but we want to defend our colleagues as well. And getting to my question, I think that in this case, there may have been some underreporting for fear of consequence. Because when we report someone as having depressive symptoms, their license is now in jeopardy. So what can we do as physician colleagues to not only recognize patients and colleagues that are suffering, but to fairly report that?
Let's begin with a moment of silence for your colleague and for all of our colleagues that we've lost, because I too lost an HIV physician colleague this year. So let's just take a moment of silent reflection. So we know the rates of death by suicide are on the rise in healthcare workers. So unfortunately, your colleague is not alone, and it's very, very concerning. Rarely does death by suicide come out of the blue. It's usually because somebody's suffering, either longer term or in some more acute way. And I guess this is where I do think the policies, both around mental health but also about substance misuse, are very limiting. A lot of people are afraid to use their health insurance or to go on meds because of the licensing questions. A lot of state licensing board questions have to do with, do you have any, have you been in therapy? Do you take meds for psychiatric reasons? And the truth is, lots of people in therapy, lots of people take meds. And unfortunately, asking the question that way is leading people either to not get the help they need or to lie. And in my mind, the question is, does that interfere with you doing your work in a competent way? Not, do you have these problems? Are you getting the help you need? Do you have the resources available to you? So that's part of the culture change that I think we need, is partnership with our licensing board, with our credentialing boards. There is, if somebody has a substance misuse problem, it's really difficult for them to get back into the workplace. The rules, the regulations, now, I do think people need help. I think people shouldn't be working if they're misusing and can't, it's not like I question that, but a lot of people really end up losing their careers because they can't get the help that they need. And so I think embracing the notion that getting help is valuable, and that if you're taking care of yourself in whatever ways you need to, that's what we value, and that's what we care about, and we'll provide the resources. And so I think all those questions need to be looked at, and I think all of the policies for recredentialing, because it's the licensing questions, it's the recredentialing questions, and some states have changed them so that they're either not there or they're asked in a way that really has to do with, can you competently do your job? So, and the other thing is, I think we often don't stop and ask people how they're doing. We say, hi, how are you? And we keep walking. And so I think really taking the time to stop and check in with people, and when we're worried about somebody, checking in with them some more. So again, my condolences to you and your colleagues.
Yes.
So, I think you were very on point in saying that there's often this disconnect with the people who are on the boards or kind of looking at the dollars and cents, and the people who are doing, the work in the clinics, and I, even in my institution, we're seeing some movement towards trying to roll back some of the things that we had recently that were helpful for burnout. So I'm curious if you have any ways that you've been able to talk to some of these people that are looking more at dollars and cents, and trying to really make a point about why this is important in a way that they'll understand.
Well, I do think that there's a growing amount of data now to show the cost of turnover. And I think if you look at just what one X or Y, whatever that physician, nurse, respiratory therapist, whatever it is, costs the institution, if you save a couple of those people, you have money to pay for these programs. And I think partly we have to partner with healthcare analysts who can gather more of those data, but I think some of the national data now really talk about the institutional cost of burnout. And so I think really helping them, because the people who are making just those pure money decisions, you have to appeal to them about pure money. And so I think especially looking at the federal data really help right now. And some of that is in some of the Surgeon General's reports. I think the National Academy of Medicine has some reports now with data, the AAMC, the Nursing Association. So more and more data have been gathered now that I think we can use. There's still not enough, but I would use the fiscal data.
I think this is more of a comment, but one thing that I feel like I learned, and maybe we learned through the pandemic, was that how do we think about caring for ourselves as community care as opposed to self-care? And, because so many of us have been doing community-based work for so long, and we've thought about and attempted self-care over and over again, and the onus becomes on us, and if we're not doing well, it's because we're not caring well enough for ourselves. So I think you alluded to this in all of your presentation around organizational change and culture change, but really shifting the dialogue around caring, taking care of ourselves as a community responsibility, and that includes checking in with each other. You have a new colleague, a new provider, seeing how it's going for them. You see your coworker struggling, like we talked about, and you checking in with them, but also creating clinic-wide or organizational-wide ways for people to get the care they need without having to seek it out. I think our clinic, I feel lucky I work in a clinic where I really do think people care about each other. We probably eat more donuts than we need to. But, I just thinking about shifting that conversation to a community care model.
I really agree with that. I think that point is really well taken, and I think that's why things like turning on the mindfulness app and having everybody do it together during, before rounds isn't just doing mindfulness, it's doing mindfulness together, and I think it has a different effect because everyone's doing it together. There's that community sense of connection. So I think that point's really well taken. Thank you. I think I'm supposed to, over here and then.
I've been a doctor for a long time, and I've worked at 3 different organizations. And during the pandemic, I came to this place I am now. I've been a physician for a long time, and during the pandemic, I had 3 different organizations. I came to this organization I'm at now, and I've never been treated so good. I have all the time I need to spend with patients. I have support staff, not just me, and it's run like an organization like we always thought it should be. And so I think to myself, if my organization can do this, why can't others? I mean, seriously, I am as happy as I've ever been. And it's not just me. We have really good support. We have really good morale. And we take really good care of the patients because we have the time and the resources to do that. And So they are organizations that do it right.
I agree with that, and I also think that when they do it right and people are happier, then people are more productive, then people stay longer, like people give it back and then the organization gives more. And I think there's, most of us just want to do a good job, and we need the support we need to just do a good job.
Hi, I'm Jen from Boston, and I appreciate this talk so much and your focus on not just individual, strategies, but organizational. And I wanted to also suggest taking it even a step further. There was a great op-ed in the New York Times by Eric Reinhardt, who's a political anthropologist and psychiatrist, and what he did in that piece was reframe burnout as really moral injury. That what the COVID pandemic revealed is profound structural oppression, racism, the inequities that we were seeing that we couldn't control as healthcare workers, and we were seeing our healthcare system was so underfunded, collapsing, and that was what we were seeing in terms of just the demoralization. And as a group of folks working in HIV, we know that our patients are living under forces of structural oppression, and we can't do a lot about a lot of them, and that we carry that weight. We accompany people through so much structural violence, and that we need to, the inequities that we talk about is not just about equity for our patients, but it impacts us too. And so what are the solutions? I think a lot of the things that people name, the community care, the solidarity, but also the organizing and advocacy for policy change. So I appreciate all of the nods to policy solutions as well. So thank you so much.
Yeah, no, absolutely. Really well taken point. Mm-hmm. And it is a great op-ed. Yeah, go ahead.
Yeah, not to belabor several other points that have been made here first, but my first question is, where was the man who spoke at this podium last working, and are they hiring? No, hi. And then my other kind of question is, I feel like a lot of my happiness at work is engendered by the people I work with, and so a lot of, like nursing staff and MA staff, and obviously, so I guess I'm wondering if you have any strategies that you've seen from physicians for advocating for other staff members in their workplace, because I feel like at my workplace I try and ask a lot of my MAs, and then I realize they're working for $7.25 an hour, and so I'm wondering if you have seen success in that area and what you would suggest.
Yeah, so again, that's going to depend on your healthcare system, but I think that there are little things that we can do. So for example, when we're rounding, at the beginning or end of round saying, anybody have a shout out for somebody who did a good job on shift today? And those little shout outs mean a big deal to people. I think we spend a lot of time saying what people should do instead of thanking people for what they do. But I've also seen things like creating a culture. So we have one unit that started doing squats together. And at the beginning, they didn't do so many squats. And they now have, as a unit, gotten up to 100 squats at the beginning of a shift. And they are looking good. And again, it is sort of saying, it doesn't take that long, and it is sort of saying, we're going to start these things a little later so that people can do their squats together. And I think there are all sorts of little things that we can do to give people some extra time, some extra shout out. Getting a donor, because I think a lot of us did things like bring food, and that ends up costing a lot of money. But there are people who want to help out and aren't sure how to help out. And the other thing we've done is we've done a lot of partnering with other professionals. So there was an attorney in town who offered to do the wills for all of us who were frontline healthcare workers, basically gave us a huge discount during the pandemic. Well, we've now worked out a deal with the law school so that all of our house staff and nursing students and whatever can go to the law school, and they teach the law students how to do the wills for all of our house staff and nursing students and whatever. And I think that there's partnerships that we can form and be creative to help take care of people in different ways.
Thanks.
And I see that I have 0 seconds, and out of respect for the clock.
Yes, but there are more questions.
Oh,
Okay. So as a director, I deal with providers with burnout. How do I address this?
okay. So the first thing to do is it's really easier to prevent burnout than to deal with it once it's happened. So I think that the more we can put in prevention things, so when bad things happen, ask people if they need a little bit of space. Sort of that whole notion of checking in with things, encouraging people to go to wherever your serene spa space is or your outdoors or whatever, sort of encouraging people and supporting people to do things and preventing it. When somebody is really burned out, I think we have to acknowledge this as a real thing. And the first thing we know is people need a little time off. That what they really need is a little bit of time off. Most people, now some people will tell you, I can't do that, that'll make me crazy, and then I would respect that. But when people need it, to give them a little time and to allow for that and give them a chance to kind of reset so that they can come back with some energy. But before they come back, you need to work with them about the things in the environment, whether it was the moral distress kinds of things or the medical record or the lack of sufficient staff, and have changes put into place so they're not coming back to the same toxic or traumatizing or burning out environment. And whatever they want, they're not alone in that. They're changes that are good for the system.
So your answer is a perfect segue for this last question. How do we teach healthcare students more about burnout before, underline before, they experience it, to save them from it if possible?
Yes, so I'm going to South Africa, Namibia, and Mozambique this week, and I have some med students that are house and cat sitting, pet sitting thing. And because they're studying for their boards. Nobody ever talks to them about taking a break. There's no courses in self-care. There's no breaks where we say, let's do something together. I told my postdocs we were going to not have our postdoc seminar and other seminars related, and I bought tickets to Six Flags. I can tell you I had 100% attendance. And so now we just have pizza at my house, and we have 100% attendance. Because I think we have to build in things for our students. They have to see it. They actually have to hear that I'm going to my ballet class every day. I actually have to tell them, like, even though I'm a workaholic, I'm actually doing things every day to take care of myself. And I think we have to model it. We have to talk about it. Now, there's probably many of you that have no interest in going to ballet, but whatever you are doing, being clear that you're doing those things, asking people what they're doing to take care of themselves, but also when they tell you this course gives too much homework, it probably is too much homework. And we all had plenty of courses that had too much homework, and that a lot less can be given. And so I think part of it is in school, changing the culture and realizing what do people need to learn in school. And most of us would say most of what we learned on the job. Most of us would say our patients have been our best teachers. Our colleagues have been our best teachers. And that I think we need to do things to kind of shift the education culture to one that is much more humane and compassionate and reasonable and fair. All right, thank you.